Is our healthcare system prepared for what's coming?
We are prepared for it. Let's not forget our individual power to actually do something about it. Everyone has to get vaccinated. The vaccines are free, they are safe, and they'll save your life.
Even though we're pleased by the evidence from multiple countries that it looks like there is a lesser degree of severity, we've got to be careful that we don't get complacent about that. Because it might still lead to a lot of hospitalizations in the United States.
For vaccinated people, this is a very different infection than for the unvaccinated. Right now, it's reasonable to assume that even if it's milder, it's not milder enough. We're still going to see, I think, a lot of unvaccinated people end up in the hospital.
It's going to be very important that we get a greater capability of testing, particularly when the demand for testing is so high. We've obviously got to do better. I mean, I think things will improve greatly as we get into January, but that doesn't help us today and tomorrow.
We know that for kids, being in school is the right thing for them, for their mental health, for their education. And we have all sorts of tools to keep schools open. There could be times when you have such severe staffing shortages that it may be hard to keep schools going. That really should be the only context, I think, at this point. Otherwise, schools should absolutely be open.
What I would say to folks out there is, look, I know it's tough right now. I know that there's a prospect of another wave with Omicron coming. But we now know more about how to stay safe than we've ever known. If you're vaccinated and boosted, your risk of having a bad outcome with COVID-19 is much, much lower. And we will get to the end of this pandemic.
We'll have more variants. I'm actually convinced that we'll have more variants, but each of them will impact us less and less. And we will get to a point, certainly by the end of this new year coming up, we will get to a point where we'll see new waves of infection. It will not have a big effect on hospitals. People will go on. People will not get really sick and die. And we will learn to live with this virus, and it will stop being so disruptive to our lives.